everyone, to the Truth About Liver Cancer, a new program produced by Blue Fairy, the Adrian Wilson Liver Cancer Association. I am Andrea Wilson Woods. I'm your moderator for today, and I'm also the president and founder of Blue Fairy. A nonprofit organization, Blue Fairy's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, also known as HCC. So remember that, you'll be hearing HCC a lot, through research, education, and advocacy. Today is our first workshop in a series throughout this year, and the focus of today is the Caregivers Corner. We are going to be speaking with 4 caregivers who all have really interesting and unique experiences with their loved ones who have battled with HCC. Now, today's particular workshop is sponsored by AZI. Really appreciate their support, and they had no control over today's content. Now, what we want to start with is a poll, and I'm going to ask everybody to take this poll. So, what is your relationship to HCC today? Are you a current patient? Are you a current caregiver? Are you a survivor? Are you perhaps a caregiver for a loved one? Or maybe you're a medical provider. Or perhaps you're not in any of those buckets and you're in the other bucket. So we would really appreciate if you could take a moment to take the poll. And I see we have 1 vote. And we've got more people in the audience. Oh, 2 votes. So if you could take the time to take the poll, and also just want to talk to you a little bit about this platform. So if you look over to the right-hand side, you will see a little box with a question mark in it. If you click that box, that is where we would like you to ask the questions today. That way, other people can see your question, and you can even upvote a particular question. So let's say that someone else has asked your question. You can vote that question up, and we'll know that that is a priority for people who are attending live. We have a few more votes on the poll. We're going to give the poll maybe 2 or 3 more seconds. But just a reminder again, please make sure to ask your questions in the Q&A and not the chat. That way everybody can see them. And also for people who are watching the replay, they will be able to look at the questions and jump immediately to the answer, which is really nice. All right, so let's make sure, can we see the results of the poll? It looks like we have a caregiver for a loved one, which makes sense. That's the focus today. And we have a few others as well. So thank you so much for taking the poll. And I'm really excited to bring our first person to the stage. So let's get rid of that poll right now. And if you hear me say Michelle is the program manager, and she's behind the scenes and she's moving everybody to and from the stage. Michelle, if you could please bring Bonnie Pickard to the stage, I would really appreciate it. Bonnie Pickard is a registered nurse who works in psychiatric nursing and case management for injured workers. Bonnie met her husband Warren in Memphis while playing soccer and became his goalie for life, married for 39.5 years when he passed away from HCC in June 2021. They have 2 daughters and 2 grandchildren, and 1 due in June. Warren's career as an electro-optics engineer in the defense industry led them to relocate to the engineering capital of the U.S., Huntsville, Alabama. We are so thrilled to have Bonnie with us today. So if we could please make sure that Bonnie comes to the stage. And I am just going to have that chat open while we're waiting to bring Bonnie to the stage. Oh, good. We have hello. Welcome in the audience. Welcome, Donica. Great. Okay. All right. Bonnie's been invited to the stage. We're still waiting on her. Sometimes there's a little bit of a delay, and that's okay. That happens. Michelle, if you can let me know if Bonnie is coming to the stage, or perhaps re-invite her to the stage. This is why we have a few minutes in case something happens. All right, there she is.
Finally, I hope it wasn't something I was doing.
Oh, no. Don't worry about it at all. Can you give us a little history of if Warren was having any signs or symptoms, what led to that eventual diagnosis of HCC?
Uh, the actual diagnosis took place in March of 2019. He had started having some right upper quadrant pain for about 3 to 4 weeks, and our primary care doctor sent him for an ultrasound, which showed some nodules that we had been made aware of the year before due to what we were told was a mild, nothing cirrhosis. And PVT, which is portal vein thrombus, which was significant. Our primary care doctor immediately contacted the GI doctor that we had seen before. They did an MRI and AFP, which is a tumor marker for HCC. It was only 64, but the MRI showed a large tumor and satellite lesions. So
Okay.
we were sent for a biopsy.
Okay.
Um,
Now you indicated there the year before. So can you take us back in time?
yeah,
Because I know with Warren, like some other people today, there was a complete lack of surveillance. So can you take us back to what happened the year before?
yes. In 2018, Warren was going to have a surgery, and during the pre-op lab work, they identified elevated liver enzymes, which prompted concern. And a GIMD who had impeccable credentials, he was Ivy League educated and the medical director of the hospital, was brought in. He did a workup, which included lab endoscopy, looking down the
Yeah.
throat, an ultrasound, which showed some nodules, a CAT scan, and a biopsy. And the conclusion was that Warren had stage 0 cirrhosis, mild cirrhosis, and that the nodules were due to that, but they wanted to do a biopsy, which did confirm that that was related to cirrhosis. So we asked the GI doctor what surveillance is needed for cirrhosis,
Right.
and he minimized it. He said he had no risk factors. We told him that Warren was a beer drinker. Warren stopped all alcohol immediately, and his enzymes returned to normal in follow-up. He had a fatty liver, and he was insulin-dependent diabetic. The GI doctor said he's got no risk factors for cirrhosis. The only thing that's needed is some lab work and an occasional ultrasound. He did one ultrasound, which showed no change. The lab work all went back to normal. So he said, you would not even know that he had cirrhosis, and you don't need a GI doctor. And he sent us back to our primary care doctor. We repeatedly reminded him of Warren's history,
Right.
but it was just minimized.
So for the people who are not familiar with HCC, having a fatty liver, being an insulin dependent diabetic, those are all, and having cirrhosis, even stage 0 cirrhosis, those are all risk factors for HCC.
HCC, yes.
So a year goes by, and then Warren has this pain and has a proper biopsy. And what was the goal of treatment, and who ended up heading that treatment?
We were in a very unique situation. We overheard the GI doctor on the phone with interventional radiology, and they mentioned the name of an interventional radiologist that was having good success with HCC. So we asked about him the day we went for the biopsy, and he happened to be there, and he was phenomenal. A wealth of knowledge about HCC. He'd had a liver problem himself when he was in medical school, severe jaundice from a medication he was taking.
Oh,
And he was the one that told us, even without the biopsy, he was sure Warren had HCC. He told us that he probably had a 3 to 6 month prognosis. It looked like it was stage 4 because of the PVT. And he immediately contacted the oncologist that we had not yet even seen, and talked to him about putting him on Lenvima,
okay.
and immediately scheduled Y90, which is a specialized radiation procedure that puts these glass beads into the liver directly. So we were, like I said, we were in a unique position because he served as a primary care doctor for us for Warren's cancer along with the oncologist. And they both from the beginning told us that there was no cure,
Okay.
that the treatment was designed to give him quality of life and extend his life. And treatment consisted of targeted meds that are not traditional chemotherapy and interventional techniques like the Y90 that he had.
Okay. And how long was he on the Lenvima, and then what happened next? Because I know the treatment maze for HCC can be all over the place, and I know that Warren's particular experience very much illustrates that.
Yes, he was on many medications throughout his treatment. He was on Lenvima and for 9 months. He had a good response to the Lenvima and the Y90. The tumor shrank. It
Wow.
actually retracted in the portal vein. And so we were very encouraged with how he was responding, and then it stopped working.
And then
So
what was next?
the next, during the course of Warren's treatment, I had asked about genomic testing, and they
Okay.
had done that on the tissue, and he showed something that suggested he might be a good candidate for an immunotherapy drug called Opdivo. So Opdivo was next. They were both the oncologist and IR doctor thought that he was a really good candidate. Unfortunately, it did not work.
Okay.
He also had a repeat Y90 at that point.
Okay. And you mentioned that you asked about genomic testing. So, how did your medical background as a nurse impact Warren's care?
Well, his doctors were very patient and tolerant. I was a case manager. I was used to talking to doctors, but it's different when it's your family member.
Yeah.
And I immediately started researching. I looked at NCI designated treatment facilities and thought Warren should go outside of Huntsville. He loved his 2 doctors and trusted them and did not want to go. And so I had to respect what he wanted. I listened to medical conferences. I listened to all the experts talking about HCC and all the different medicines. I looked at clinical trials. I would take in journal articles to the doctors and say, "What about this?" And they were like, "Okay, Bonnie, yes, we know about this." But at one point, when the Opdivo didn't work, he was put on Opdivo plus sorafenib. Our oncologist thought he might really benefit from a combination. And when that did not, before he got put on that, I asked about a clinical trial medication called Azeto-Bev that was getting really good results.
Right.
And the doctor actually ordered it, but it was turned down by insurance.
Oh, gosh.
So he was put on sorafenib and Opdivo. That lasted for 5 months. And then we were able to actually move him to the Azeto-Bev. It got approved the next time around. And he was on that from August of 2019, 2020. I'm getting my dates confused, but until March of 2021. They had a really good response with minimal side effects to that particular combination.
That's great. I'm curious because I know this is going to come up again. When the insurance turned it down, was there any discussion about patient assistance programs? Because they do exist, and I feel like doctors don't talk about them or think about the fact that all of these medications that are going through the clinical trial phases can have patient assistance programs for that very reason, that insurance might turn it down because it's not approved yet. So was that ever brought up?
Not because it was not as because it was turned down. I actually did talk to the social worker in case an approved medication got turned down, and so we did talk about that. But I didn't know that it was I was not aware that it was available for a medicine that was just rejected because it was not yet approved.
Yeah. Wow. Okay. And what was his screening routine like throughout treatment? I mean, were they keeping an eye on everything else?
Our doctors were very, very diligent. They saw Warren They did scans, which included an MRI of his abdomen and a CT of his chest every 2 to 3 months. And they were doing lab work probably every 4 to 6 weeks. Every time we had a scan, we saw the interventional radiologist. Warren was an imaging specialist, and he was all about those scans. So the radiologist sat and went through every scan with us, which he didn't always agree with the cancer center's radiologist reading of those scans. There was a different radiologist at the cancer center actually reading them every time, but because our interventional radiologist knew Warren's history, he took that into consideration. So they were, I cannot speak highly enough of them in terms of how diligent they were with that. They were also, even though the statistics were grim, they were also hopeful and encouraging.
Yeah. Do you mind sharing? I know we didn't talk about this when we were preparing, but I happen to know a little bit more about you and Warren. Would you mind sharing how Warren actually correctly diagnosed himself with something other than cancer? Can you share that little story?
Yes, yes. Warren, probably 10 years before, was told that he probably had stage 4 lung cancer because of something that showed up on an MRI or CT of his chest. And he was actually scheduled for a removal of a lobe of the lung.
Gee.
And he was diligently researching on his own and found valley fever, which is very prominent in the Southwest and can mimic lung cancer on scans. And he had been in the Southwest for a testing procedure out in the desert for his work. So he went to his pulmonary, diagnosed himself with the valley fever.
Yeah.
And I want to mention, in terms
Please.
of researching, one of the things I was led to was Blue Fairy, because the statistics are so grim when you read statistics about HCC. But Blue Fairy had stories of actual people and hope. And I shared those stories with Warren, which was an encouragement to him.
Oh, I'm so glad to hear that. Would you mind sharing what the last month of his life was like? Because I know he really lived with cancer.
He did. He continued working and then eventually decided to just be a consultant for his company. The last month, we had no idea it was his last month.
Right.
Our daughter got engaged the end of April and was going to get married the following January, and suddenly decided, which we think was God's prompting, to get married that Memorial Day weekend. So the last month in May, May to June, we went to a family beach trip. We celebrated our granddaughter's first birthday. Our daughter got married in a small backyard wedding, and he danced at her wedding and walked her down the aisle.
Oh.
We went to a Father's Day baseball game on June 20th, which was 6 days before he passed away. So he truly was living with cancer.
And one last question. What led Warren to go to the hospital? You just said that last month, you didn't know it was his last month, and he really was doing so much. What ended up happening?
He woke up on a Saturday morning early complaining of abdominal pain and had an episode of diarrhea. Abdominal pain wasn't unusual, but there was something different. And he never took pain medication on any regular basis. I could not get a blood pressure. I called an ambulance and they took him to the emergency room. His blood pressure only was able to be brought up with specialized medication. Initial scans and lab work in the ER did not show anything that they were really concerned about. Again, it was on a Saturday, so we're dealing with all on-call doctors, not our regular doctors.
That's right.
We were told that they were going to do a surgical consult, admit him to ICU. They put him on IV antibiotics in case he was septic. The surgeon came in to see him and said he did not need surgery, was very dismissive, told me that he probably had ascites, even though the week before he'd had an ultrasound, had no ascites. And that he might be septic from that. I could tell that the surgeon was looking at the stage 4 cancer diagnosis and just writing it off. I actually asked for a different surgeon, but was told because of a prior surgery he had, he belonged to that group. Then I asked for a GI consult. They finally involved the on-call interventional radiologist who was planning to do a specialized scan. His hemoglobin and hematocrit dropped significantly. They called for blood and were in the process of giving him blood, but it didn't arrive soon enough. And he essentially passed away from hemorrhaging internally.
Sorry. I'm so sorry. What what did the IR? I know he reviewed the records after. What did he think had happened?
Yeah, both his IR doctor and oncologist were shocked. And our IR doctor said that he saw a small blood clot in a compensatory vessel in the liver, and that those are very fragile. The vessel was blocked by that large clot that initially showed up. And so you develop other circulation pathways. And so he thinks that actually ruptured and that was the source of what happened.
Oh, I'm so
And
sorry.
it was, it was difficult for us. My younger daughter was there in the emergency room with us. My older daughter, it was actually her wedding anniversary, and she was on a wedding anniversary trip. But eventually, our family felt like this was God's gift to Warren because he lived up until the last day.
Yeah. Well, Bonnie, thank you so much for sharing. And for those in the audience, please remember we're doing a Q&A at the top of the hour, and go ahead and put your questions in now. So if you have any questions for Bonnie, I'm going to send you back to the audience. So please stick
Okay.
around. And Michelle, if you could bring Sharon Dixon up to the stage. And again, just as a reminder, if you see questions, you can upvote somebody's question. And that lets us know that that's the most important question that we will start with at the top of the hour. So Sharon Dixon is going to be joining the stage. Sharon is 60 years old. She lives in Peerless, Texas, which is a small rural community in Northeast Texas, with her Chiweenie, Ollie, and 2 cats, Sassy and Chloe. Sharon lost her beloved husband, Jimmy, to HCC on October 27th, 2022. She spends her time gardening and working to raise awareness of HCC. And that timing was impeccable. Welcome, Sharon.
Hello, Michelle did good, didn't she?
She did. She did. So, same initial question for you. What symptoms or signs did Jimmy have that led to that diagnosis of HCC?
Well, Jimmy found out he had cirrhosis in the 90s. And the doctor that he saw in the 90s basically told him that, well, he had cirrhosis because he'd had hep C, and that the cirrhosis, he was going to die. And the way he explained it, it made it sound like to Jimmy that he was going to die like anytime then. Well, he didn't, and he felt fine. And so he kind of just blew it off, and the doctor never said anything else about testing anything else or anything. And so he knew, that he had cirrhosis, but nothing was really going on. And then in the 2000s, like 2015 and everything starting then, he would every once in a while, he would have an episode with the cirrhosis. By then we had a different doctor who was better. And, but there wasn't a lot of, anything going on or anything. I mean, he'd have an episode if he drank too much over the weekend, he would hurt, but he'd get over it. Well, in December of 2020, he started having a lot of pain, and he said it wasn't like the normal pain. Because like I said, I mean, for 20 years almost,
Right.
and but he said it wasn't like usual, and that it was his whole stomach area, which his liver pain was, but it was worse, and it was like even going up like his shoulder to his shoulder and everything. So I got him to go to the emergency room, and they discovered that he actually had a pancreatitis attack going on right then when they did the ultrasound. But the doctor that was the ER doctor, she wanted a CT to be done because of something that they had saw on the ultrasound. So they
Okay.
did, our CT machine was down at our hospital, so they took him by ambulance to a little neighboring town about 20 miles away, and they did a CT scan. Well, the guy that did that one, he saw a lesion on his liver. And so when they came back, they admitted him in the hospital to treat the pancreatitis, and the doctor came and talked to us and said that they had saw a lesion on his liver, that she was concerned because of the cirrhosis, that it was cancer. And so she said that she wanted to, see if she could get hold of a GI to come do a consult while we were there. Well, it was the week before Christmas, and there's only one GI in our town, and he was on vacation
Oh gosh.
because it was a week before Christmas.
Right.
And so the hospitalist was wonderful, though. I mean, she was trying. She said, "Well, can we reach outside of,
Right.
and see if we could get somebody?" Well, they said, "Well, let's do another CT scan." Well, so they did another CT scan, but that time it was at the hospital, and they said, "No, there's not anything on it. There's nothing." That they must have been wrong. And
Okay.
so they said there was no lesion. And so because of that, even though she had sent referrals for the GI for when he came back, was hoping, to get him in, quickly, like the 1st of January,
Right.
they didn't consider it an emergency. And so the first appointment they would give me was March 1st.
Oh,
And in the meantime, Jimmy went back to the emergency room. Oh my gosh, I don't know how many times. Uh, and
for the
they
pain.
for the pain, yeah. And they did a couple more CT scans and said, "Oh no, there's nothing there." Just all at our hospital. His primary care was like jumping through hoops trying to get something done. Says, asked for an MRI. They said no, they wouldn't approve it. They let him. They did all this test on his heart and everything, thinking that was what was causing the pain was his heart. Everything was fine. They even did a mammogram, but they wouldn't do an
Ah,
MRI.
oh my goodness.
But they wouldn't do an MRI.
How did you, because I know it was quite unusual, how did you actually receive Jimmy's diagnosis?
Well, on March 1st, we finally got to see the GI. We went in, and and Jimmy told him what was going on, and with the pain in his shoulder, and he's like, "Well, why did you wait so long to come?" And it's like, well, this is the first time they would this is the first appointment, and I had been calling and asking for cancellations and everything. Well, he was, he knew what what it was, and so he said, "Well, we need to get an MRI." And so he scheduled him, and they called me, and that was on a Monday. They did the MRI on Friday. Well, our hospital has My Chart, which is the online where you can see your test results and everything. So not 20 minutes after we left the hospital from having the test, it popped up on my phone that there was, new results. So I looked at it, and there was this long thing about the MRI telling everything they found and everything. And right there, it was that it was definitely HCC, which I didn't even know what that was, and that there was a lesion and there were some satellite lesions, and so it was like that's how we found out. I mean, right there, reading it on the phone.
Oh,
And but we didn't know anything about HCC at the time, and so Jimmy was that weekend. He was trying not to worry. He's like, "Well, baby, they'll just they'll cut it out or whatever," because he said it doesn't sound too big, because he wouldn't know the size. But then it's not your whole body; it's in your liver,
right,
and then the ones around it too. Uh, and he wasn't also thinking about the condition of his liver,
right.
and so he thought it was it's like, don't worry.
What
Well,
kind of research did
I'm
you
a
do?
I'm a warrior, so I went home, and as soon as he went to sleep,
Okay, I
I
didn't
was
know that part.
Googling. I was Dr. Google. Yes, Dr. Google. Uh, and everything I saw and was reading was like, oh my God, nothing was good. It was all bad. The only thing good that came from my Dr. Google experience was I found Blue Fairy. And
Oh,
that's the only thing good that came from it. Uh, but I also, when I got home that Friday, though, I called the doctor's office, and I'm like, okay, I'm reading this test results, and do we or when are you going to talk to us about this? And they
yeah.
said, well, he was off that day, but to come in first thing Monday morning. And so all weekend, Jimmy's trying not to worry. I'm not telling him what I'm reading, and I'm like staying up all night reading everything I could get my hands on. And
Oh,
so then we go see him Monday, and he's really good. He was wonderful. We loved him. Uh, and he's like, it's yeah. He said it's cancer. He said I want to refer you to an oncologist. He said I want to refer you to an interventional radiologist too. And he told Jimmy, he said, after everything, he said, I don't really treat that. He said, I can treat, your liver and stuff. And because Jimmy also we found out that he had esophageal varices. So
okay.
he'd had, those, and had to keep those banded so they wouldn't, bust and kill him. And he had precancerous polyps in his colon. So he was having, he was dealing with that and had several colonoscopies and that stuff removed. Uh, but so the oncologist's office called us first and told us that, well, they wouldn't see us without insurance. And thank goodness that original doctor in the hospital, when they admitted him in December, had
Yeah.
the social worker, even though the hospital was saying, oh, no, there's nothing, because it's really not here. It's an imaginary lesion. She, she had him go ahead and the social worker and send all the stuff in to Social Security for SSI and Medicaid.
Oh, good.
And so that was good that she went ahead and did that. So we didn't have to wait, even though they didn't actually say until he was actually officially diagnosed in March. But that way they went back until December and covered, all those tests that they ran for nothing,
Oh, that's
So
good.
that was good.
I have
But
a question about,
yes.
I know the GI had talked about getting Jimmy on the transplant list.
Yes.
And what was Jimmy's reaction?
Like I said, our GI was wonderful. And he told Jimmy, he said, I want to get you on the transplant list, because he just fell in love with Jimmy. And Jimmy said, well, no, they're not going to, he said, I smoke. He said, and I drink still. He still drank his, a couple beers a day, And he said, well, no, I can take care of that. I've got this medicine that I can give you to help you quit smoking, quit drinking. And, 6 months, we'll get you on the list. And he said, I know, he said, I have friends that are, that doctors on the thing, and, I know who to call. And Jimmy's like, no. He said, no, because he said, I am at the time 62. He said, I'm 62 years old, 61 then. And he said, I lived my life. He said, and the reason I have this is because of the choices I did in my life. He said, and it was a hell of a life. And he said, he said, there's not enough livers. He said, there's not enough livers. And he said, I'm not going to take a liver that somebody that's 30 and has 2 kids to raise and a wife might need, that hasn't lived their life. He said, I could not live with myself knowing that, that I was alive and somebody else died that hadn't had a chance to live.
Yeah. Oh, I'm
And
so glad you shared that. I'm going to jump a little bit because you guys made such a monumental decision fairly early on. And I would love for you to tell us what the GI said about the treatment that Jimmy was on, and then what you guys decided to do.
well, we finally got with the insurance, got to see the oncologist. He started Jimmy. First he did Lenvima for so many months, and then he did Opdivo. But Jimmy was getting worse instead, was getting worse and worse. And
Oh,
his feet and legs were all swollen. And I'd been asking the oncologist about the liver enzymes, because I knew about them. They weren't good, and
yeah.
oh, well, no, the tumor marker's good. Yeah, don't worry about it, Well, so I sent his GI a picture of his feet and legs,
Yeah.
and he called me and he's like, what is going on? And so I told him, and I said, they just keep doing this. He said, well, let me look at everything. And so he did, looked at all the test results and stuff, and called me back. And he said, Sharon, he said, yeah, he said, the tumor markers are going down. He said, it's probably shrinking the tumor. He said, but it's destroying what little is left of his liver.
Yeah.
He said, and that's what's causing all this swelling. He said, basically, he said, it's killing him. And he said, if you don't stop the treatment, he said, it's going to kill him. And so I said, well, what would you do? Because we trusted him.
Right.
And he said, if it was me, he said, let me give you a referral to hospice. He said, if Jimmy decides he wants to he said, get him stronger, get him feeling better. He said, if he wants to try treatment again, he said, I'll take him off hospice and, he can go back to treatment. He said, but if we don't do something now, he said, he's not going to be here in a week or two.
Right.
And so we prayed and we talked, and it was hard because it's like you hear hospice and you think, okay, I'm going to die tomorrow.
Yeah.
And that's what, when they came out and did the intake, that's kind of what Jimmy, told the nurse. He said, so I'm just to die. And she said, no, sir, that's not what this is. It's about making sure that you feel better so that you can enjoy what life you have. She said, because you haven't been feeling good, have you? And he said, no. He said, I felt terrible. He said, I can't hardly do anything. And she said, well, that's what we're going to try to fix. And they did. And he did. And we lived, and he had it was wonderful last year. It was. We were blessed.
Oh,
But it was hard decision. And it was hard because explaining to family members that we were going to stop treatment,
that's a
and
very good point.
yeah, and
Yeah.
it wasn't easy sometimes because some didn't understand. It's like, well, why are you quitting?
Right. And
But we
too
had no
often
choice.
people see that as quitting. So I have another question. I'm gonna save it for you. And so I just want to remind people who are watching that at the top of the hour, maybe a little after, we are going to do the Q&A. So please go ahead and put your questions in there. Sharon, if you would stand by in the audience, we're going to bring you back for the Q&A. And Michelle, if you could bring Sarah to the stage. And I just want to highlight two things for people who have joined us so far. One, that finding a doctor you trust is essential. For Sharon and Jimmy, it was their GI doctor. For Bonnie and Warren, it was their interventional radiologist. So it's so critical to find the doctor that you trust. Now, we're going to bring Sarah to the stage. And let me tell you a little bit about Sarah. Sarah Schiltz is a dedicated patient, family, and care team advocate that strives for a cure, well-being of our care teams, keeping hope alive, and celebrating joys in life every day. Her passion for the promise of optimal health care for all stems from the loss of family members early in life and her experience with cancer striking those closest to her, including her beloved sister, a breast cancer survivor, and most recently, her husband, who was diagnosed with liver cancer in 2016. Sarah, thank you so much for joining us.
Thank you for having me, Andrea.
So would you please tell us about your and Greg's journey with HCC and how it started?
Well, Greg was diagnosed with hepatitis C many, many years ago. And his doctor said, it's asymptomatic. We aren't going to treat you and get you sicker with the drugs that were available at that time.
Right.
So he let it ride. And when the new class of drugs came out, Greg said, I am sick. I want to get rid of this. And so he saw a new doctor, and that doctor put him on Zapatier, which cleared the hepatitis C. We were doing a happy dance about that. And then afterwards, the doctor did a routine scan just to make sure that he had a baseline on his liver. And that's when he was diagnosed with HCC. He had 2 lesions on his liver.
So during those years that he knew he had hepatitis C, was that previous doctor the one that didn't want to treat him with the older drugs? Was there any kind of ongoing scans and surveillance?
There was not. There was one scan, and at that time, the scan revealed a really slight mark, and they discounted it. And they said, that's nothing. And years went by, and he didn't do another scan. He just did lab work twice a year, and that was it.
I'm starting, unfortunately, to see a pattern here where patients had known risk factors and were not under regular surveillance. So talk to us about when you got that diagnosis and what the next steps were.
Well, it was a shock to us because Greg was a healthy guy. And so the doctor, when he gave us that diagnosis, he had to leave the room to get something. And I immediately got on my phone and saw Dr. Google, pretty much like what Sharon was talking about. And I started reading, and it was terrifying. And so when we got home, I did the same, and I didn't want Greg to have to worry about anything. I wanted him to, to heal and live his life. So I took it on myself to get educated as much as I could. And like Sharon, I read everything that I could, and Bonnie too. I read everything that I could get my hands on. I've been in healthcare my whole career, and so was able to, get on some of the, the clinical trials and medical journals. I was rabid with, everything I could get my hands on, and that's when I fortunately met Andrea and the Blue Fairy organization, which was just a godsend to me, because the support system, the education in layman's terms, the hope that you can live with this diagnosis for years. So that was a godsend to me.
Oh, I'm so glad to hear that. What makes, I think, Greg a little bit different, perhaps from Jimmy and Warren, is that initially, well, actually, Jimmy would have been too, but he turned it down. But Greg was eligible for a transplant.
Mhm.
And when you're eligible for a transplant, it does take you on a very different journey. So can you talk to us a little bit about that?
Yeah, we elected for transplant because it gave Greg the best odds of survival. He was not eligible for resection, but he was eligible for liver transplant. And so we went down that path, and it was an extensive process. To become eligible, you have to have every test known to man. And you have to basically prove that you are Superman and you're healthy. So they want to make sure that whoever they give the liver to, you're going to be able to not only survive the surgery, but also the post treatment. And, because you're on a lifelong immunosuppressant therapy, drug regimen. And so he had cardiac catheterization, dental work, a psychological exam to make sure that he wasn't addicted to anything. And so he was listed here in San Francisco. We were very grateful for that. But the wait times are well over a year at that point in time. And so he did have a bridge to transplant, a number of treatments, including chemoembolizations and the Y90 radiation treatment, to ensure that the tumors would remain in the criteria that they have for liver transplant. So we decided to multi-list because of the long wait times. And so we went down to New Orleans. They do the majority of liver transplants in the United States at Ochsner. And so we went through the same head to toe testing to determine eligibility, and he was listed there as well successfully.
What I find interesting about the transplant process is that you have to be healthy enough, to your point, all these extensive medical, psychological checks, so healthy enough to survive the surgery and then survive living with a transplanted organ, but you have to be sick enough to be eligible.
That's
to
right,
move
isn't
up
that?
the list.
Yes.
It's a
Right.
miracle that anybody
It really is.
gets an organ. It really is. So you guys are multi-listed. He is doing bridge therapy. And was there ever a time where a liver became available, or what happened next?
Yeah, so he became number one on the transplant list in New Orleans in September. And
Wow.
so we moved there, and my sister and her husband joined us for support, which I was so grateful for. And we were in New Orleans for a number of weeks, and he got 4 phone calls. You're basically on call, of course, 24/7. And 4 times we were called into the hospital because there was an organ that was made available. And so, unfortunately, the organs that were harvested were either too cirrhotic or not the right size for Greg, whatever. And so, during that time, they did a scan, and they decided or discovered that his tumors had grown out of criteria, and you are delisted. So that was by far the lowest point in our whole journey. So we went back home, and we were still listed in California. And so our doctor was just
Was
the
the
best.
criteria different?
They have different criteria, yes, at that time. And so our doctor was just she was remarkable, and really, really loved Greg, and wanted to do whatever, she could to ensure that we could get a liver here in San Francisco. So we did additional treatments to ensure the livers or the tumors could shrink to remain listed. But unfortunately, they did grow out of criteria here as well. And so he was delisted in San Francisco in February of 2018.
What did you do next when he was removed from both those transplant lists?
So we went to UCSF and enrolled in their clinical trial program. And thankfully, Greg was eligible for the immunotherapy trial, the Himalaya trial, AstraZeneca Himalaya trial. And so he went under treatment, and he was fortunate enough to get both of the drugs on that trial, and then was able to respond for several months to that treatment. We felt very fortunate. And then the drugs stopped working, and he wasn't responding. So at that point in time, we went to a new drug at the time, which was Lenvima, a new systemic drug or systemic treatment. And so Lenvima gave him a lot more time. We were originally given 6 months when he was delisted. But the immunotherapy and the Lenvima regimen was just, we were very fortunate to have that time. And he started on his bucket list.
Oh, well, tell us something from his bucket list.
Greg was a surfer, and so he always wanted a Woody wagon. So he bought a 1947 Woody wagon, this ginormous vehicle. It was just a joy. And went to Hawaii. We're both beach people, so we were able to travel. Greg was an artist, and so we built an artist studio in the backyard for him to create, and just lived life to the fullest and celebrated every day.
What was one of the major milestones that Greg wanted to reach?
He told his doctor when he was first diagnosed, he said, I want to make it to 70. That's my goal. I want to make it to age 70. And he did. He did. And he turned 70, unfortunately, in the hospital, and passed away 6 days later. But I will say, when he decided it was time to stop treatment, he had enough. He was in the hospital, and he told his doctor, it's time. I'm done. And so she said, okay. And he said, well, damn, I should have told you I wanted to make it to 80.
Oh, that's so sweet. That's so sweet. Oh, goodness. I know Greg got a very special tattoo, and I know the other people on this panel are just going to love this. So can you tell us a little bit about the history of that tattoo, how it came about?
So Greg, we were very fortunate to have mentors. As I mentioned, with the diagnosis, it was overwhelming and terrifying. And so we went and found some mentors that had been on the transplant journey as well. So two gentlemen that shared their stories and gave us advice and support, and they were just really special people. And so one of them, Bob was his name. We were in Hawaii, and we had learned that Bob had passed away. And so the next hour, Greg was sitting in a tattoo chair, and he had the word cancer tattooed on his middle finger.
So everybody can get that visual image right now. I just love that. I think it says so much about his sense of humor and his character.
Great sense of humor.
Yeah. Oh, Sarah, thank you so much. We're going to say goodbye to Sarah just for a moment. She will be back for the Q&A. So there she goes. She's leaving now. We're going to bring Swapna to the stage. And just a reminder, please put your questions in the Q&A. And then if there's a question you like, you will see that I actually already put a question in there. You can upvote it. And that lets us know that that question's really important to you. So we are welcoming Swapna Roopesh to the stage. Swapna is an HCC caregiver, rare disease advocate, a public health professional with over 13 years of experience in community work. She has previously worked in the areas of genetics, cancer care, and biotechnology. Currently, she's pursuing the Master of Public Health program at Johns Hopkins Bloomberg School of Public Health. Swapna, thank you so much for joining us.
Thank you so much for having me, Andrea. So good.
And before we jump into your story, would you let everyone know where you are joining from today?
Oh, I am joining from Bangalore, India. So we have this beautiful spring in Bangalore. Bangalore is one of the cities.
Thank you. And I so appreciate it. So when I asked Swapna to do this, I thought she was still in the US on the East Coast, and she still agreed to do this, even though it is much, much later right now in India. So I thank you so much. Can you tell us about your story and where it began?
Yeah. So this is about my father-in-law. He is 75 now. And ours is a story where, we kept pestering just because the levels of the liver panel was high, the GGT levels were very high. And we kept bothering the doctor so much, the GI especially, and he just wouldn't budge. He said, Swapna, I think you're just worrying too much. And we had this regular ultrasound. We are one of those families who does regular preventive checkups in India, which is quite rare. And so the ultrasound had lesions, but then doctor said, no, lesions are very common in older people, and they are just hemangiomas, which means they're just benign. And you are just too worried about, he just said that my knee and my husband, we were worried. And then we said, no, let's do at least a biomarker. And then we did AFP. The AFP level was really low. It was just 15. And the doctor said, ha, I told you, it's nothing to worry about. You're just too worried about everything. I said, no, but it's still 15. It's not 10, right? So 10 is the parameter. And then they said, like, no, it's just 15. So it's like, okay, you can have a CT scan done, and we had a CT as well. So the CT, the reporting of CT was suspicious because it said lesions seen so and so, and we also noticed that the lesion had grown in size. And the CT said that the lesion is carcinogenic / benign, and there was a question mark. It was like, what is that question mark even supposed to mean? So then I remember this day when literally I spent half the day, and the GI and two interventional radiologists, they sat with the report. They went over the CT again and again. It was a team of 3 doctors. They went through this report and they said, I think it's just hemangioma, nothing to worry. And this is a scenario where the patient is completely asymptomatic. He had no history of hepatitis. He's a non-alcoholic. He's a non-smoker. No history of cirrhosis. So,
But he had 2 other risk factors, did he not?
yeah, he had at this point of time he had been taking medicine, metformin, for quite some time for his diabetes mellitus, and he's also obese, and he had fatty liver. So 3 risk factors, which
So
was actually,
diabetes, fatty liver, and obese. Those are
yeah,
risk factors. Oh my
they
goodness.
are.
Tell us what led up to that that ER visit. What happened at home?
So this half a day of adventure where the doctor just shoos away my concern. He says that, this is just hemangioma. And exactly 20 days later, during peak of COVID, June 2020, he has his dinner at around 8 p.m. It's a Thursday evening. And suddenly he says that I'm feeling very uncomfortable. And then we notice that his stomach is bloated unusually. And he just collapsed. So we took him to the ER. Our very kind, we couldn't reach the ambulance, unfortunately, but our very kind friend came to the rescue. And we have a hospital right next door, luckily. But then he said, no, we'll not go to that hospital. We'll go to a tertiary hospital. So that was a very good advice by a friend. He was a quick thinker, I would say. So we went to a tertiary hospital when he had collapsed, so during times of emergency. But since it was night and 8 p.m., 8:30 p.m., we had only duty doctors on call, and they were checking his heart and seeing if anything is wrong. And the doctor was just running through his reports, and I totally forgot to tell him about this, about the thing that happened 20 days ago. And then I suddenly told him, see, we had a CT scan, and this very young doctor, he was so brilliant. He said possibly there's a hemorrhage inside, and
Yeah.
possibly the lesion has burst out. So it was 1 a.m. until when an interventional radiologist came through, and then they did what has to be done. They did an embolization to stop his bleeding.
Right. And he also had surgery, correct?
Yeah. So this post 1 week of his embolization, he had a resection. We found a very good team of hepatologists, thanks to his my father-in-law's very close friend is a neurosurgeon. He mentored us throughout this journey of right from the diagnosis when he collapsed until now. He follows up the case very closely. So he guided us to an expert team of hepatologists. They went through his reports, and they said that resections he's a good candidate for resection. He's 73, but he's a good candidate for resection, and it is curative. There are chances. And my father-in-law agreed. He said, yeah, let's go ahead. And then we had the resection done. And after that, for 1 year, he was very active, and there was no, like, he never had any signs and symptoms, so he recovered from his resection. He didn't have any signs and symptoms.
And so he goes a whole year, and then what happened that led him to start treatment again?
Yeah. So remember when I told you the AFP was low? So his
Yep.
AFP levels were consistently low. And that's when our team of hepatologists told that there's another biomarker called PIVCA. And even I had a folder of research papers tucked into my my handbag all the time, So I just downloaded everything about PIVCA and read through it. And he used to do that PIVCA every 3 weeks. Every 3 weeks, we were diligently following up on that biomarker along with AFP. So one of those times, just after a year, the levels of PIVCA became abnormal, and then we met our doctor. He said, "Okay, let's check what's going wrong," and that's when we saw that there's something wrong, not on the liver but around the liver. So, in the spaces, the peritoneal spaces around the liver. So he said that possibly some sort of seeding has happened because the HCC had burst at the first, initially.
Right.
So that's when we were immediately referred to Etizobev. We were very fortunate to be referred to Etizobev. It was very recent, and it was just recently approved by USFDA, and we were lucky to start him on that treatment. He was on Etizobev for a year.
For a
Yeah.
year. And how many cycles was he supposed to do? How many did he do? And how was he feeling at the time?
At the time, he does yoga every day for an hour, and he's on physiotherapy. And he was on a close. An assistant used to help him do his physiotherapy, but right now he does it on his own. And during immunotherapy, he did not have any visible side effects except for extreme fatigue, because for his age, at the age of 74, when he was taking this immunotherapy, so he did not have rashes or any other reactions. But then he had this extreme fatigue that he couldn't handle at all. He went into depression. So there, a lot of things happened, and also he's recently developed Parkinson's. So that Parkinson might be possibly induced by drug, is what doctors say. But then the physiotherapy is for to manage his Parkinsonism symptoms, and he does yoga, and he's good. He's good. He's hopeful.
So his disease is stable today, his HCC,
Yes.
correct?
Yes.
But he has developed these Parkinson's-like symptoms, correct?
Yes.
Tremors
Yes.
and things like that. And so what is, what is he doing for that right now? And how is his HCC continue to be followed up?
His HCC has been continued to be followed up through the same regimen. We are diligently doing the AFP, PIVCA, the combination, the biomarker test very regularly. We also follow up on his liver panel very regularly. So almost every 3 months or at least 2 months, we do his test now. Initially, it was every 3 weeks, and I had this entire chart made out, tracking how is levels of AFP and PIVCA were fluctuating up and down, and so that's we are relying on that at the moment. So he's not had any PET scan very recently. He's had it last year. So doctor has advised us to not do any scan until the biomarker is suspicious. So and for his Parkinson, he's on. Since it's a Parkinson-like symptom, he is
Right.
on Syndopa. Yeah.
Okay. And I want to touch on something else because Sharon alluded to it. It wasn't until Jimmy was on Medicaid that the test could be done. Everything that needed to be done could be done. So I know that when he did start the immunotherapy, the Atez-Bev, that treatment was not completely covered. So what did you guys end up paying out of pocket for that?
Close to $40,000, everything put together
Yeah.
for a year. Yeah.
Wow. I'm so sorry.
And we were on a patient assistance program. So despite of that, we incurred so
With the
much.
patient assistance program.
Yes.
Oh my gosh. Okay, God,
So
that's
initially
crazy.
we were given price chart, just like it's like a menu card. They show us, oh, this is the treatment, so this is the price. And then my husband is just sitting and wondering, oh my God, it's so expensive. How are we going to manage that? And then the social worker, he's just so reluctant to tell us about the patient assistance program. He's so reluctant. He just didn't tell us anything about it
Oh my
for
gosh.
until a week. We kept following up with him, asking, see, we have to do this for a year. Please help us if there is something. And that's when he said, oh, there is something.
I shouldn't laugh. Oh my gosh. Well, we may come back to that because I know Sharon has a really good story about that. I want to ask one more thing because it comes up all the time with cancer treatment in general, issues with nutrition. But when you have a GI cancer, especially HCC, where you're dealing with both the cancer and perhaps underlying conditions that are making things worse, there are usually challenges with nutrition. So can you talk to us a little bit about any challenges your father-in-law might have faced with nutrition?
Yeah, we had one strange series of symptoms like post his resection, hepatectomy, and unfortunately, we don't have a patient community. Unlike in developed countries in India, we do not have a patient community or even a patient advocacy organization. That's when I found you. I found Blue Fairy, in
Oh,
fact. So we he used to wake up in the midnight at around 2 a.m., 3 a.m., and he used to just say, I'm hungry for no reason. I just don't know what to do. And then we would just go back to our hepato team and they say that this is unusual. Maybe he's just not sleeping well. Ask him to, plug his CPAP machine properly. Maybe he's just sleepless. And then we say, no, he's genuinely hungry. And nobody's able to identify why he's hungry. And then I found a series of Reddit posts on Google, and that's when I found out that many other patients have this. We are not that odd men out, and the hunger can be managed through a high protein. We were advised a high protein regimen, but at bedtime we used to give him bananas or sometimes omelets, and we used to always ensure that he has protein bars on his bedside so he can manage his hunger pangs. If in the night he doesn't have to wake up.
I wonder if that was his body. I'm totally speculating for the people in the audience. I wonder if that was his body's way. I mean, when you have resection, your liver grows back.
Yeah,
And that's
yeah,
the beauty of the liver. It's the only internal organ that regenerates itself.
yeah.
And I just wonder, I mean, that's a lot for a body, right? Like that's a lot of work.
Right.
And I wonder if his
Yeah.
body was just like, we need more energy. We need more energy. You know what I mean? I don't know. But
Exactly.
just
Yeah, it
curious.
was. It was.
It
Yeah.
was.
Even
Okay.
me thought that it is that should be the reason.
Yeah. Oh, wow. That's so fascinating. All right. Well, Swapna, I want you to stay here and we are going to start the Q&A here any minute. So we're going to have Michelle bring Sarah, Sharon, and Bonnie to the stage. And I'm going to minimize myself a little bit. And so I do see about half the registrants are watching live. And we do have some questions here. So we're going to wait for the ladies to join, but if you have any questions right now, put them in the Q&A and make sure you put them in the Q&A and not in the chat. Although I love reading what's going on in the back chat panel here. So please put your questions in the Q&A, and we have one that's been voted all the way to the top. And we are going to have the other women come to the stage, but while they're joining, Swapna, we're going to start with you with this first question. Your father-in-law is still alive, so it's a little bit different. But is there any one memory of your father-in-law that you really cherish? And what is it and why?
The week after his resection, when he was just resting, and my children had, a school from home because it was again peak COVID, and they had this online schooling, and my son was practicing for one of his dance, and he just raised up the volume and he started dancing and practicing, and suddenly this father-in-law of mine, who's usually a very composed and serious figure, he just gets up and he dances. That is his first dance of his life.
Oh,
So that's something that we will not forget. And after that, post that, we always tell him, why don't you just get up and dance like that? He's like, no, I just danced because it was a spur of moment. I felt happy that day.
oh, that's so sweet. I love that. Right, we're still waiting on Bonnie and Sarah to join us. So if you're having any trouble, just communicate with Michelle in the back chat there. Sharon, same question for you. If you could hold on to one memory forever, what would it be and why?
Well, I was torn because there's so many,
Right.
but I think when the last New Year's Eve we had together, when we were out to eat, Jimmy asked me, he said, if you had known now, because, we planned to, live to be 90 or 100 together and sit out on the front porch old. And, he said, if you had known now what if you had known then what you know now that about
Right.
getting the cancer and that we're not going to have the time that we thought we would have and everything. He said, would you still have married me? And I said, well, yes,
Oh,
of course I would, and so I didn't know it, but then, because when we got married, we just, we had just a very small way. It was just us and the preacher and our witnesses. And that was all that was there because it was spur of the moment. Well, when the hospice chaplain came to visit him for the first time when he got on hospice, he told him they had something called the Joy Project, where they tried to help somebody with their wish. And so he asked Jimmy if he had anything in mind that he would like them to try to do. And he's thinking, that Jimmy's going to ask to go for a trip here, that, some kind of bucket list thing, which is
right.
what they usually do. Jimmy asked him if they could give us a wedding, a vow renewal.
Aw.
No.
And he didn't ask me about it first or tell me. I didn't know anything about it. To the volunteer
Oh.
coordinator calls me later on that week, introduces herself, and tells me that she understands that we need to get together and plan a wedding. And they did. And he was afraid to wait because our anniversary wasn't until August, and this was in the 1st of March. But he was afraid that he would not, because he felt so bad then. He felt worse then. I mean, he felt so bad because he was just now then getting off the medicine. He didn't think he'd be here till August, but he was. But so we did it in April. So I have 2 anniversaries now. But but she said that is the first time that a man has ever asked for a wedding. on their
Oh my
wish.
gosh, that's so sweet.
And they did, and he even said he wanted. We wrote our own vows, even,
Oh,
and that's
and
that
I
just
I know you shared photos in the community as well, and they were so beautiful. They were so beautiful. All right, stay with us, Sharon. Sarah, same question for you.
That was an easy one. It was our wedding day. Our wedding day really set the tone for our whole marriage. We enjoyed life. We liked to have fun and didn't take life too seriously. It was a small wedding, just our close friends and family, and we got married at the beach. And there was nothing formal about it, with the exception of my wedding dress and his tuxedo. So the family and friends came dressed in shorts and flip-flops, and we played on the beach during the day and went boogie boarding and played with beach balls, and then got married in the afternoon and had a reception in the evening. And then at midnight, Greg and I went down to the beach and we swam in the ocean in our wedding gear.
Oh my gosh.
Yeah.
Oh,
It was a great memory.
that's so great. All right, Bonnie, same question to you.
The one that I think about is I was cooking for some friends, and I'm a terrible cook. And I got busy talking to my friends and not paying attention to what I was doing. And I set some oil on fire in the kitchen. So Warren ran in the kitchen to rescue the oil from the stove and put it in the sink, and for some reason turned water on it, and it sent black oil all over the ceiling. And his comment was, "I hope I never have to teach you that lesson again." And I love that, because what he wanted was to be our hero, and he was. And he had such a dry, wonderful sense of humor. And Andrea, you know the story that I shared with you when he had the Y90 treatment.
Oh, share that. I think
share that
all the
really
ladies will
quickly.
appreciate it.
He was told, you cannot sleep with your spouse for a few days after this treatment. And he said, well, whose spouse can I sleep with? So it just cracked the doctors up, and they just loved him. But that just was indicative of who he was.
Oh gosh, I love that story. I'm so glad you shared it. We have another question here. And this for anybody who wants to jump in. Do you feel the oncologists were informative enough about the treatments recommended as to the side effects and how much time the treatment may add to your life? Who would like to take that?
Warren was on so many medications. He was on almost every medication that was out there.
Yeah.
And every time we were given a list of the side effects, because the doctors really don't know what side effects are going to affect what people. And we were fortunate that one of the ones that's very common, hand and foot issues, Warren didn't have. So I think they did the best job they could. As far as how long it would last, that's individual too. One drug lasted 9 months, and then another one lasted 1 month. So it just depends on the individual's response. So for me, I would say I think they did the best they could.
Okay. Anyone else want to take that question?
I would agree with that, Bonnie. Same with Greg. I mean, so many different treatments, and you take a look at the side effects, and they have everything in there that could possibly go wrong.
Yes.
But the one thing that I tried to do after a number of treatments, is ask the doctor, what side effects should I be most concerned with? Like, when should I freak out and go to the hospital? So having them guide me there was comforting and helpful. Because some of these side effects are really scary and life-threatening.
They are.
Yeah. Yeah. Sharon or Swapna? Any thoughts on that question?
In our case, we kept asking. In fact, my husband kept asking because my sister-in-law is a Down syndrome adult. So my father-in-law, he was very worried about what's going to happen next.
Right.
they So he kept asking how hopeful can we be with this atazolizumab treatment regimen. But then doctor did give us a good list of side effects. Thankfully, we did not have any of them. With regards to how it could extend his life till date, he's not told us an answer. He keeps telling us that you just be hopeful. We'll just revive him every 3 weeks, and we'll just revive each of his PET scan, and I'll let you know if something goes haywire. So,
Okay. Sharon, if you don't mind sharing very quickly before we go to the next question, how did your oncologist react when you told him that Jimmy had decided to stop treatment?
I said that I was killing him. But
Oh, goodness.
unfortunately, we weren't blessed with ones like y'all seem to have had. Yeah, ours wasn't wonderful. But yes, said that, yeah, that he would be dead in a couple of weeks if he stopped the treatment, and that I was killing him.
Oh,
And
good.
and he even before he even, when I was questioning about the liver enzymes and stuff, the last time when Jimmy went in for his blood work, he did not order a liver panel because then there was nothing for me to question.
Oh my goodness.
Wow.
You know, Andrea had gotten Jimmy hooked up with the gene testing thing, and everything was all good to go. And so I called his office and said, you know, Tub was telling him, I'm so excited. And I said, you know, they just need you to order some blood work because Jimmy didn't have a biopsy done. And he said, oh, well, that stuff doesn't work anyway. We're not going to do that.
Oh.
Makes me so mad. Oh my God, it just makes me so mad. We have
And
one.
I actually
Oh,
I
go
actually
ahead.
got Jimmy approved for one of the drug things because he had originally wanted to do the Avastin Tecentriq combo, and our insurance denied it. And so I got him approved with the thing. You know, reached out to the drug company and stuff, and they were going to give it to Jimmy for free. And the doctor said, "Oh well, no, I've already decided to go with Opdivo, and the insurance has approved it." I said, "But it doesn't have as good results with the liver cancer." Well, yeah, but that's what I'm going to do. And he wouldn't take it. Yeah.
Makes me so mad. Okay, we have an amazing question here, and I think this is also for all of you. Thank you, Donica, for this great question. There seems to be a recurring theme of a diagnosis being minimized, misdiagnosed, or dismissed altogether. What can or should a patient or loved one do? We usually trust our medical providers and take them at their word. Who would like to tackle that one first?
if you don't mind, I can take it.
Go ahead.
With my experience, just you have to be less of a caretaker and become more of a researcher, or just get into the shoes of, even if you're not from a science background, just research and then be persistent, because I believe that medical professionals themselves, they do not have experience. And since I come from a rare disease background, HCC at one point was a rare disease, so now it is no more a rare disease, right?
Right.
So you have to be persistent, and if you bother your doctor so much, they will at one point budge, and they will guide you to what next to test for.
Anyone else want to take that? What can or should a patient or loved one do?
Well, what I tell everybody is, because I mean, when Jimmy got it, I didn't know, and I trusted the doctors because I thought, well, they know more than I do. And I just kind of just rode along at first until things started happening. And then I started questioning, and I found out that you have to question, like you have to research, you have to be an advocate for, because if not, who will? And so that's what I tell everybody. I said, you've got to speak up because there's so much that needs to be changed. And if we don't speak up, it won't change.
Right.
Absolutely.
The squeaky wheel, gets the grease, and so I'm going to be a squeaky wheel for the rest of my life to try to get things changed.
Yeah, I agree with that 100%. I also think it's really important to find that right doctor and that right team of doctors and that right cancer center, because we went through a couple of them before we found that one that Greg could connect with, that took a vested interest in his case, that we could trust. And so make sure, that would be one bit of advice. Make sure that you do your research, and don't be afraid to get second, third opinions and find that doctor that will connect with you.
I agree with that. And, you know, we were, and I'm a nurse, and I was
Mhm.
lulled into a false sense of security when the GI doctor told us his cirrhosis is no big deal. And I
Mhm.
did not pursue looking up what can happen with cirrhosis. You know, I was asking the questions, well, how do we monitor it? And he was telling me, and I trust I should have researched that more on my own. So even if you get good answers, I would say look up
Mhm.
and research on your own to make sure that the good answers are the right answers.
Right.
Yeah. I have a question, and then we'll go to the Q&A, and I hope the panel cannot hear my dog going bananas right now. um, and oh gosh, I think I forgot my question. It was, I'm looking at the question here. That's really good. Yeah, I'm gonna get back to Victoria. Great question. I want to ask all of you because often the caregiver, the spouse, the daughter-in-law, the child, you have to be the squeaky wheel. But what do you do if you have a patient who, I know Bonnie, you talked about Warren did not want to leave once you did find a doctor he really connected with. But what do you do if the patient's reluctant to get a second opinion because they don't want to hurt the doctor's feelings? What about that? How do you manage that?
Good doctors are not going to get their feelings hurt.
Mhm.
They
Yeah,
are going to
that's right.
encourage second
That's
opinions.
right. Yeah.
So if you feel strongly about it,
Mhm.
you might want to even talk to the doctor.
Yeah.
If it's a doctor that is not good, they're going to be threatened by it.
Mhm.
And
Right.
well, I can't say that they're not good because there's some doctors that are good that have great big egos and just don't want to be questioned.
Right.
So, but I would say maybe talk to the doctor on your own.
Mm.
And I know that that's kind of tricky when you're trying to respect what your loved one wants.
Mhm.
Right. Right. That's such good advice though, Bonnie. I really appreciate that. And this is what I say as well, is that a good doctor is not going to be defensive. They're not going to get
Mhm.
offended
That's
because
right.
all of them would get second, third, fourth opinions,
Yeah.
right?
That's right.
Yeah.
They would all tap into their network and do it. So why not? Okay, so we have one more question here from the audience. Victoria, again, such a good question. How does one stay motivated to live life with the HCC diagnosis when no treatment works? Who would like to take that?
I'll start there because I have to say this is going to sound really strange, but the best years of our marriage was the last year, and even when he was so sick, and that's because we had this looming expiration date, so we didn't take anything for granted. Priorities became crystal clear, and every single day matters. And this gift of life is sacred, and every little thing in every day matters. And there's new treatments coming out all the time. To Swapna's earlier point, is HCC is no longer a rare disease, and so there are drug companies after this, and a number of clinical trials are starting to reveal that there is more time that's going to be given to patients with HCC. So never ever give up hope.
Oh, that's such great advice.
When Jimmy realized that, what the diagnosis meant, he said something to me. He said, I'm dying. He said, I'm dying, but I'm not going to die every day. He said, I'm not going to let cancer kill me every day, and I'm not going to let cancer beat me. He said, he said, wait, he said, I'm just going to live my life. And he did. And I love what he said on the One Liver to Love interview. You can't have a pity party. He said, you got to
Yeah.
make the most of the time you have left. And that's what he did. He lived every day. And that's just what you have to do, because he said if you get so caught up in it that's all I'm thinking about, well, cancer, then you let it beat you.
Do.
I think living with hope is so critical. And I don't think I even shared this with you, Andrea, but the last week of Warren's life, I even said, whenever you're ready to stop treatment, we can. It's your decision. And he said, that's giving up, and I'm not going to give up. So he wanted whatever treatments were out there, and every treatment was a bridge. It gave us more time for the next treatment. And like Sarah just said, the treatment, they are making such great inroads with treatment options with HCC. There's some that have come out just in the last year that weren't available when Warren was sick. So hope is an important part of living every day.
And you guys alluded to this, and I want to just reiterate that Blue Fairy has never aligned with the rare disease moniker that's often given to HCC. And we haven't because we knew from the trajectory of HCC that it wasn't going to be a rare disease in the US forever. It's not rare worldwide. It's one of the most common cancer diagnoses worldwide. It's the third most common cause of cancer deaths worldwide. And here's the crazy thing is that by 2040, they estimate that HCC will become the third most common cause of cancer deaths in the US.
Oh,
It
wow.
will overtake breast cancer. And right now there's about 800,000 new cases per year and 700,000 deaths. They expect that 800,000 to be 1.4 million by 2040.
Oh my goodness.
And so there's so much work to be done, but to all of your points, there's always new treatments coming out and new things to explore. We have just a few more minutes left. I'm going to give everybody 1 minute. Any parting words you have for any patients or caregivers or even providers who may be watching this, a month from now, 3 months from now, year from now. And Sarah, I'm going to spotlight you and start with you.
I would echo what we were talking about earlier, and that is never, ever give up hope. And as I mentioned, life is to be celebrated, and every little moment of every day, there's beauty in when your loved one is with you, regardless of whether or not they are healthy. And so just, you could get hit by a bus, right? And so make sure that you live life to its fullest and every single day and every moment.
Thank you so much. Bonnie, any parting thoughts?
I would echo what Sarah just said and just reinforce what we've been talking about, that if you're not connecting with your doctor, or if your gut is telling you things, don't be afraid to get other opinions. It may only affirm what you're being told, but that is peace in itself.
Yeah. Thank you for that. Sharon, what about you?
The same thing. I mean, we don't know how much time any of us have, and the doctors don't know that, how much time you're going to have. I mean, the doctor told Jimmy he'd be dead in 2 weeks, and hospice had to recertify him twice. But just, just cherish every moment and live and just make the most of it and find happiness in everything, because you can find happiness every day in something if you try.
Right.
This is so inspiring, guys. Swapna.
Yeah, since we're talking about Caregivers Corner, I would say that as a caregiver, these wonderful caregivers they inspire me. And my suggestion is, caregivers, you should, at that crucial point of time when you're taking multiple roles, you're just not being a caregiver, you're just being so many things at one point of time. Like I was a mother, I became a daughter from a daughter-in-law. And so you have to just take care of yourself so that you can be on your toes all the time, right? So a caregiver has to take care of themselves so that they can love enough.
Yeah.
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 Oh, that's such a good point. I remember someone saying to me one time that you were how did they put it? You were a nurse, you were a butler, you were a housekeeper, you
Yeah.
were a cook, which that's very debatable whether I was a cook. It was they just went through this whole gamut of things, and I was like, really? I did all those things? And it was like, yeah, you did do all those things. Well, I want to thank, ladies, thank you so much. Thank you, Swapna and Sarah and Sharon and Bonnie, for just sharing your story and your wisdom. And I just want to remind people, this is an ongoing program in a series. The best way to get notified is to follow us on Crowdcast. And the next program is going to be on Saturday, April 15th at the same time at 12 noon Eastern, 9 a.m. Pacific time. And we are doing a two-part Meet Your Multidisciplinary Team. So on April 15th, not August, April 15th, we will be meeting the liver disease doctors. So they include gastroenterologist and hepatologist and transplant hepatologist. And then in June, we will be meeting the medical oncologist. So stay tuned. Please subscribe on Crowdcast. And again, ladies, thank you so much for your time. And
Thank you.
give Michelle
Thank
a
you.
thank you too. I don't know if her camera's on, but we're going to thank Michelle too for
Thanks,
moving
Michelle.
everybody
Thank you, Michelle.
Yes.
around the stage. And everyone, have a wonderful weekend.
Thank you. Thank you.